Male hormone replacement is fairly straightforward, especially in comparison to female hormone replacement. Primarily, we're only looking at the hormone of testosterone. The symptoms of testosterone failure or lack of testosterone is primarily those of fatigue and sleep difficulty, anxiety, and lack of libido. Certainly there's lack of energy and lack of strength that may also occur, but interestingly the most common symptom, contrary to what the television programs would indicate, is that of severe fatigue. Testosterone is a hormone that is extremely vital to the physiology of both men and women. When we consider the use of testosterone, we want to consider its safety as well as how best to deliver it. We'll talk first about safety. We try to use what are termed bioidentical versions of testosterone, meaning it's testosterone that is the same as what is naturally in your body. When we stick to a bioidentical form or the same type of testosterone, it does not cause any increase in risk factors such as cancer, heart attacks, or stroke. One of the concerns that was determined a few decades ago was that testosterone was the cause of prostate cancer. That has since been proven not to be the case. In fact, low levels of testosterone are associated with higher incidence of prostate cancer. The mechanism of that can be explained to you if that is something that you were interested in finding out. But apart from the worry of excessive use of testosterone, there's really not any consequence in the use of testosterone. We monitor the levels carefully, not only of the testosterone itself, but also of the estrogen, as well as the blood count that is also affected by the use of testosterone. Testosterone is best given through the skin. There's not an oral version that's available, and if there were, it would be not a usable substance because it's hard on the liver. So it must go through the skin. That leaves us with three basic options, one of which is not a very popular option because it requires such frequent application and it has some risk to it, and that is using a topical form. The other two versions involve either an injection or the placement of a pellet. The placement of pellets is what we would refer to as the gold standard. It is the most ideal and the most effective administration of testosterone. When we use a pellet, the pellet is placed under the skin in the upper hip. It takes several minutes to administer the pellets through a trocar or a needle, which is not a painful procedure in and of itself. You feel only a little prick of the needle for numbing and a little burn from the medication as it goes in, and then after that, only pressure. The following day, there can be some soreness associated with it, and generally this soreness lasts for a week to 2 weeks. In some individuals more sensitive to pain, it may last a bit longer. But even so, the pain or the discomfort is minimal and feels similar to a bruise or the soreness you get with an injection someplace. It will not limit what you do or how you live or work. The use of a testosterone pellet allows you to have a very continuous, constant level that is very stable. It takes about a month for it to peak at its highest level, and then that peak is maintained for about 5 to 6 months. During that 5 or 6 months, there's no need to worry about additional medication. There's an exception. If we underdose, then we can give a booster dose to help increase, and we can explain that to you in better detail as you inquire. But apart from that, there's very little maintenance until it's time to get your next dose of testosterone. The injectable version of testosterone has been around for quite some time and is very common in its usage. You see different protocols of practitioners in how it's used. Some will give the injection once a month, some will give the injection every 2 weeks. The ideal way of giving the injection would be daily, but that's a bit difficult to convince most men to do, to give themselves a shot every day. If we were to use a daily shot, you would closely mimic the level maintained by the pellets themselves. But since that's very unlikely to occur, the most complete and effective way of administering the testosterone is to do it on a once-a-week basis. The injection is given into the muscle, and we, in most cases, teach the patient how to do it themselves and do not require the patient to come into the clinic on a weekly basis in order to receive their injection. A self-administered injection is given in the lateral portion of the thigh, where there is a large amount of muscle so that you're not going to do any damage or strike bone. And in this location, there's no big arteries, big veins, or big nerves for you to damage in any way. After the injection is given, we recommend that you place your finger over the area of injection for a few minutes in order to minimize the bruising. The most common side effect of the use of an injectable version is some soreness that begins about 24 hours after the injection and lasts another day or two at the most. It generally does not limit your activity. For those who are unfamiliar with giving a self-injection or don't have someone who will be giving the injection, the nurses are able to teach you on your first injection fairly easily how to give your self-administered injection. Or they can teach a spouse or other significant individual who you choose to give your injection if they are themselves unfamiliar. The follow-up for the administration of testosterone is fairly straightforward. If one has the pellets, then they return at about 4 weeks after the placement of the pellets for lab, which doesn't do anything for the current dosage other than if there is the need for a booster dose, and is used to direct the treatment in 5 or 6 months when the pellets themselves run out. The pellets, as they are slowly absorbed, do not leave behind any residue of a medication or filler or anything of that nature. The pellets are made of purely testosterone, and so there is full absorption as the time goes past. The follow-up on the pellets, therefore, is purely for one lab, usually only the first time the pellets are placed, and then at the 5 to 6 month intervals, however long your pellets last. Follow-up for the injection is usually 2 months following the initiation, and until we find the right level, we'll continue to see you every 2 months to check blood tests and other things to assure that your estrogen is not becoming elevated and to keep an eye on your total blood count. Estrogen, in some cases, will cause men to have some side effects, and so we monitor the level carefully. The blood count will go up in about half of men on testosterone replacement, meaning that the bone marrow is producing more blood cells than is usual. In order to be safe, we generally recommend individuals who are on testosterone replacement consider regular blood donation. We'll also, as I said, monitor the estrogen level. If estrogen becomes burdensome in the body, where there is medication that can be used that will prevent the conversion of testosterone into estrogen. Now, some individuals will say, why do we ever allow estrogen in the male body? Isn't estrogen a female hormone? Well, the answer to that is it certainly is found in greater abundance in women, but is just as vital in men. We do keep an eye on the estrogen levels, and if it begins to block the effects of the testosterone or cause other side effects, we can easily place you on an estrogen blocker, which is a pill that you take by mouth once a week. If you have questions or would like to consider further other problems or associated benefits of either pellets or injections, please don't hesitate to ask.